No, we do. It is 6 o'clock, we'll call this meeting to order. Brad, what about these?
Most kind, gracious Heavenly Father, Lord, we thank you this day, and Lord, we thank you for all your many blessings in life, Father. And Father, we just thank you, Lord, for the opportunity to be here tonight, Lord. And Lord, I pray, Lord, that everything that's said and done here tonight will be pleasing and honor to you, Father. Father, just go with us now, lead, guide, direct, and all that we do. In Jesus' name we pray. Amen.
Amen.
Next, pledge allegiance.
Pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Next, is approve the minutes for October 19th and 26th. Got a motion, need a second?
Second.
All vote? None opposed. On the next agenda, we've got to amend this because of some technical difficulties. So I need a motion to amend it. This is,
You want the way it's supposed to be read?
Yeah, it should be amended to the following. GMAS shall provide the county with 15 days Board of Equalization hearings and/or assistance, and the work on the project shall begin January 1st, 2016. It was just some details that was left off.
I'll make a motion to approve.
all vote. Next, approve all of financials. Need a motion?
I make a motion.
Need a second? All vote. On the E&Rs, we moved them up. We need to approve or deny the following E&Rs. First one is Natalia Oliver on a mobile home duplicate. We'll do these one at a time. Mr. Dave
Got any question?
can explain it to you if y'all have questions.
You want to do all of them at once?
We have to do it
One at a time.
If there are no questions, I need a motion on that.
What was, this duplicate that he was billed with the land and billed
Yes, sir.
with the other? And it's just for 1 year?
Yes, sir.
Make a motion, approve it.
I need a second.
Second.
All vote. Next, Ashley Clemens, mobile home duplicate.
Mr. DeSantis, if you would, just give a little brief why they're duplicated, just so everybody here will know. Just give a little
What's that?
brief oversight of each person's,
Uh-huh.
so everybody know what's going on.
Okay, all right. We can do that.
On Ashley,
Ashley Clemens.
it says it's a duplicate, so was he billed
Twice.
twice? He was billed as a sticker
It was
plus.
picked up on enter, so it's just a matter of getting rid of one of them.
Okay, did he add it to the land?
No, sir.
Okay, so he just, it was picked up twice.
It was
and
picked
he
up
billed
twice, yes. Yes.
So I need a motion.
I'll make a motion.
Need a second.
Second.
All vote. None opposed. Stacy Nell Smith, mobile home tax were paid in Appin County.
There's a copy of the receipt behind it on the package that you all should have received.
When they move from one county to another and they move them over home, when that county puts it on, like if somebody moved one into Hazelhurst and it came from Bacon County, don't we check to see if any back taxes is owed?
Most of the time, we don't know where it came from. We're lucky if we know that they moved it in. We usually have to find it to know that they moved it in. As you well know, sir, most of these things are moved on Saturdays, on Sundays, with a farm tractor in front of them. And we have no permitting that is required to place them.
So this home was moved into Jeff Davis County?
No, moved out of Jeff Davis County to Afton, yes,
It's in that, and it was current up to this year.
yes.
It's current, and it did move, I make a motion, we accept it.
All vote. Next one, Diane Bookhart, John Bookhart, corrected acres from 2014 and 15.
This was a case of land was sold at different times, filed an appeal. We heard the appeal in September, August. Met with GMAS during the appeal. Thought everything was resolved, sent out a 30-day letter, and then they came back and said, no, the acreage was wrong. That's why it's here. Acreage has since been corrected. I guess at some point in time, nobody really truly know how many pieces have been sold or what have you. So it's requesting a refund for 2 years, this year and last year.
On how many acres?
Currently, something acres, 58.16 acres,
How much?
58.16.
Yeah, and it was what? You said some was sold off at different times and a couple of times.
Yes,
So
sir.
what did it start with? And did it go up or did it go down?
It went down. It went down from 87.136. No, that's not right.
No.
58 acres.
Up. Okay, was it surveyed? How do we know the correct acreage?
Good question. I don't know if it was surveyed or not.
Now, wait a minute. If I had 300 acres and I come in and told y'all over there that I sold some, and I don't have but 166 acres now.
Here's what's there now. 4.56 of open land in category 1, 7.06 acres of open land 4, and 22.27 acres of woodlands 8.
Still right on about 33.89. Yeah, but how did we know that if it hadn't been surveyed? Well, I was just getting at, if I said I had 300 acres and I sold 130, and I come in and tell them if I didn't have it surveyed, how can we take it off?
Because what happens is when every deed goes.
Like I said, an appeal went through.
Goes, when the deed is recorded, it goes to the clerk's office to tax assessor.
They deduct it.
And what they do is they record it and deduct it off the total acreage of the property sold.
Well, they can take out the machine and then run a parameter around it and tell you how many acres. It'd be, on that eyeball, I mean, she didn't miss it.
They did,
Like,
when they sold it and closed it out, in the lawyer's office, and got a deed on it, and they go and record the deed, then those papers, once they got on the deed book, and then it comes back to the tax assessor's office, and they deduct it off, so that they would have a survey.
No, not necessarily.
Not necessarily.
It depends on whether if it was for the bank loan the money, if the bank requires a survey or not.
You don't have to have a survey.
You don't have to
You pay for it.
they get your surveys for the land that you sell from unless they wanted to go borrow money on the land. Then the bank may not require it, but now in order just to sell a tract, they don't have to, the survey's not required by the law.
And so with all those 3 or 4 sales, it adds up, and it gets back to what it started at.
Yes, sir. That's my understanding. That's what was presented to us. But like I said, it went through an appeal process. everything was supposedly resolved, we sent out a 30-day notice. And then she came back after that to say, no, it wasn't right again. So that's why it's here, that's why it wasn't corrected beforehand.
She's not, they're not here tonight, are they?
No.
What did they say is wrong with it now?
It's fine the way it's been corrected now. It said that there were too many acres, they were being built for too many acres.
Once they had the bill, then she come back, and y'all thought it was all okay.
Yes.
Now, she came back, she
She
said.
came back after that.
All right,
and
y'all
said-
have changed it since then?
Yes.
Okay.
Yes.
That's the part I didn't know, that y'all come back and changed it, so there was a mistake made in the office, and now it's correct.
Yes.
I feel like she's satisfied, or she'd be here tonight to defend her part. Did you know Miss Susan?
Sorry. She did.
Do you know if she's satisfied with it, it is corrected now?
All I know, well, I just texted her and asked her was the property survey, and she said it was. But I just know she said that the acreage was wrong. I really haven't talked that much to her about it.
But they have it corrected now.
My understanding is that she met with Kathy again, and she's happy with the correction, with this correction.
I need a motion to accept it.
I'll make a motion to make that corrected. Y'all satisfied with it?
Yes, sir. She's satisfied with it, no, we're satisfied with it.
I got a motion, need a second.
I'll second.
All vote. Okay, Celia Copeland, discuss completion of Pearson Drive.
Good evening, everybody. Mr. Toller, thank you for the work on my car. I made it to Atlanta and back.
That's a good thing. When you-
Thank you very much. This evening, what I want to discuss with you is trying to find a remedy to completing this road. And in conversations with Gary and some other parties, what we're trying to do is make up a difference in what it would cost to get the road completed. And just a little history, you know, we did start the work last year, had a very rainy, wet winter, and it took a whole lot more dirt than what we expected to haul out. And then, of course, what you haul out, you gotta bring twice as much back in. That was for the rail spur. The road was under construction, and the county did go out to the best of their ability and start hauling dirt out, hauling dirt back in. We hired some additional dump trucks out of Alma, which wound up moving a whole lot more earth than what we could ourselves. They just simply had better resources to get the work done. In the last 10 months, sorry, not quite 10 months, probably about the last 9 months, the road has been just sitting, and there's still a lot of work left to be done. The Development Authority, we've been very successful in obtaining the grants that we applied for. We've actually been awarded all 3. We're waiting for funding on our final grant. And it will enable us to kick in on the road above and beyond our commitment for the rail spur. So that's good news. What I need your help with is an agreeable solution, and what I'm wondering if we could do to see if Fran would help us finish out this road is to offer them a dollar-for-dollar tax credit and for them to kick in to help us finish this road. If the county, and this is just my opinion, the county administrator might have a little bit better insight on this than myself, but in my opinion, in my experience with what the county has done, it would take forever for us to finish this road with our limited resources. I think we've only got 3 dump trucks.
Basically, I mean, you talking about here, you talking about just dirt? Is dirt what we need? I mean, is that what?
No, sir, the There's still a crossing that has to be done, there's a drainage ditch that has to be, a drainage pipe has to be put in at the railroad. There's more dirt that would have to go over that, of course. Up at 341, there would be an XLD cell lane. This is a requirement by DOT, which that itself is pretty expensive. There's still some mucking that has to be done up close to 341 in the area that is already paved, because we're actually going to widen the road and it's going to be shifted over a little bit. A lot of dirt work still left to be done, yes, sir, but ultimately we still have to pave that too. And we still have to do the crossing. Now, the dirt work on the other side of the railroad tracks, Fram went ahead when we were going through trying to get the water main connected to the plant. In order to do that, we had to have a shoulder, which meant we basically pretty much had to go ahead and build the road on that side. Well, they did go ahead and jump in, and they did all the dirt work on that side. I'm not an engineer, but in my opinion, I would say that all that needs to be done over there is just cleaned up and shaped up a little bit. Maybe a little bit of dirt to shape it, because we have had weather on top of it since they did that. The vast majority of the work is on the 341 side of the railroad tracks.
I understand that, but what, and I wasn't here last year, okay?
Right.
So I'm asking a question.
Go right ahead.
But what did the county promise to do? Was it dirt work, or did they promise to pave, did they promise to do decel lanes? And
In the paperwork that I have seen, the letters of intent, the memorandum of understanding, the economic development incentive agreement that is in their bond package, it simply states that the county agrees to provide a public access to the plant. There are plans that I think y'all may have in your package. Gary, did you provide them with that?
No, not all the plans, not the actual details, the
Okay.
architectural.
The plans that were drawn up back in 2011 shows that the road goes from 341 through the wetlands that we did get permitted for the road, across the track, and then it turns and connects to where the industry has already paved up to the edge of the property.
But again, what I'm asking is, did the county commission say, we're gonna pave this road?
The county commission said that, what I have seen in minutes, sir,
We met, when we met, what's the name of the people that was going to do the road that y'all said y'all had the money extra and would do it, the blueprints that y'all got, who drew them up?
Carter and Salute.
Yes, Salute, okay.
Right.
And Ray and I was at the meeting, and if you dig back the minutes at Miss Bonnie, we agreed to haul the dirt in and to the railroad track, but we have never even mentioned anything on the other side of the railroad track. You'd have to show me some minutes or freshen my memory, and at the beginning, like you said, you like Brad, you come in after the fact.
I came in to do the cleanup work.
Yeah,
Well, and yes, sir, I have been present at the times that you're talking about where we've stood out there on the road itself.
yes,
All I'm saying is, everything that I have seen, every documentation simply states, and I hate the vagueness of it, but it simply states that the county will build a road to, or provide a public access
public access
to the plant.
Public access could be a dirt road or whatever. It doesn't say that the county will pave and get the XL lane and the one that you pick your speed back up and to shift over or anything. We done that because y'all asked, and refresh my memory, did you not say that y'all had money in the still left that could do
Yes,
it?
yeah, that's what I was saying a while ago. With the funding of the grants, we actually will have money left there, and I'm waiting on 2 final invoices to come in so I can close it out. So I don't want to discuss exact dollar amounts or anything, because I hate to be wrong. Until I have those final invoices, all I can tell you is, again, with the plans that we had received and that were sent over to the county administrator at the time, years ago, I don't even know who the gentleman may have been at the time, but all those plans, every bit of it was already fully designed to provide the XLD cell, and there is a letter that says that the county would spend or do a certain dollar amount up to in kind, and then there's another dollar amount that they would spend on actual construction of the road. Did I forward that to you, Gary?
I'm not sure which document you're talking about. I have a lot of documents, but
It would be a letter from the county commissioners, I think, and Ray and Sherry. Sign. Can I approach you?
sure.
How about that, sir?
This is what I have.
Good for letters.
There's more behind it. Everything that was relevant, there's a lot of.
Yes.
So Dave, this year,
There was a lot of documentation that I had forwarded to Mr. Falk, so that letter, I can provide it, I do have that letter.
So, well, the bottom line is, I mean, how much more work or how much more money are you asking the county for?
Again, without having these final invoices in, it's kind of hard for me to nail down an exact number. If you want me to speak in general,
Roughly,
rough estimate, I would say approximately 300,000, which is far less than what the county had committed in the statements to DCA.
When we met at the Development Authority meeting, Mr. Wooten was there and I was there, and y'all brought it up, and we said at that time that we could do the in-kind work and make the path, to the railroad track.
Mhm.
And I would, if you know when the minutes, when Ms. Bunny was taking the minutes, that we agreed that we would take and go across the railroad track. I have never agreed or ever even heard.
Well, all right, here's my question then, and I'm not trying to be the devil's advocate, but legally, whose minute supersedes whose? Because we have letters of intent and.
Who signed the letters of intent?
Ray Wooten and Ms. Lytle attested to those. Then we also have the economic development agreement, which Mr. Polk has a copy of there, that was dated back even prior to those meetings. And it is signed off and sealed with the county seal and attested through the court system.
But
So-
if you took, then Mr. Wooten would have had to bring, he can guarantee, what, $5,000? Sure. Am I right? I don't know, 5 or 10, we talking, how much is they, 9 or 300? Okay.
Right.
So,
That's what.
we
that's what you know it's been on.
we need to know when that is, and then where we voted on it in our meeting. And we have to do that, and probably the best thing, I know you want some kind of answer, but I don't know what the rest of them gonna do, I'm not fixing to agree that we go into spend that money
Well,
there and cross the
yeah.
railroad track at all.
I'm
To me,
sorry.
if you cross the railroad track, if that's named Brown, then that's theirs, and rather than call Jeff Davis Pellet Company, so then we would take and, you get the figures of the other 2 invoices in and see how much money is going to be left, and then let's sit down and see what it's going to be. What we can do.
And I agree, I don't think, and again, I apologize that I can't give you an exact dollar amount tonight. I think more what I was looking for is a methodology of getting this thing finished. I mean, this is the final stretch of having all this put behind us. Would the county commission be in agreement to offer a dollar for dollar tax credit to Fram, not committing to any dollar amount or anything? I know we can't do that tonight, but would that thought be appealing to you guys as a remedy?
Well, we already got the bonds, and are they getting any credit? I don't, just.
The bond is
they are.
spent.
Huh?
The bond is spent. We're on grant.
Yeah, the bond is spent, now you're on grants that you can get, all right, that's over, but I mean, all that is done through the county. All right, then, are they getting any credits now on taxes, and what are they getting?
They are getting personal property tax abatements up to for the first 5 years, and after that, it phases in. For the
That on
next,
equipment and land,
well, the development authority owns it.
well, the development already owns the land, and after that time, they're gonna be paying y'all back. On it, or
Yes.
buying it from y'all, or y'all gonna rent it to them, or what?
Well, actually, I think once the full tax abatement comes in, or the full maturity of the tax abatement, Mr. Hall, let me get you a definite answer on that. That's a good question.
I agree with you there, but if just, and I mean, I'm using crazy numbers, but if they got $2 million worth of equipment out there right now,
Mhm.
and they get tax abatement, okay, and you said 5 years, am I correct?
5-year full tax
Okay,
abatement.
in 5 years, they got 5 years of depreciation that comes off of that. So once that they start paying taxes, it's gonna be on half of whatever it was to start with.
All right, but we're also talking about a $91 million investment.
Yeah.
Is
Okay.
it-
91 million, but then in
Yeah.
5 years, it's gonna be, say, just 50.
Well, with their plans now, it looks like they're gonna be going beyond the 91 million. Their original plan was to do 3 lines, with a blueprint for 5. And I'm meeting with a blueprint for 5 lines. So that 5 lines is looking more and more
So
realistic.
they got how many now?
They've got 2 up and operational, the third one will be online in a couple of months. Overall, once I have the final invoices and I can talk some hard numbers with you, I think you'll see that it's still a very big win for this county. That was a huge accomplishment to get that into this county. And there's a lot of things in the future that could come along with the fact that we have landed such a big deal. I'm not trying to persuade you, I'm just giving you my personal perception of this. If we can help, then I think we should, just so that we can continue to keep good relationships with our industrial community and let them help us recruit more.
I just, I'm kind of, when I started, the only thing that I was ever told was that we agreed to furnish the dirt for the dirt work. That's what I was told when I
That's what I was told too.
Now, that may not be the case, so, I want to see everything and then hear what you got and get a final number on this before we go any farther to say, we'll do this on tax sale or we're gonna just pay the money or what we're gonna do. I want to see everything before I make any kind of.
I don't even want to ask you guys to commit to any dollar amount. I mean, I was supposed to have final invoices in on Friday. I paid for them all day today and still unsuccessful, but, if y'all do want to table this, and I will provide the letter showing what the in-kind commitment was and then what the dollar amount of cash was.
And you'll get the minutes from that meeting. Sure.
Do y'all want to just table this?
I thought you got to.
We don't have to, well, we don't have to, but really it's just discussed, it's just not whether it was put on there that we either approve or deny. It was just discussing for him to give us a layout of what he would like to have, and that's what he did, so we don't have to, bring back all the minutes and everything and where we voted on, and we look back to see when it was voted on in our meeting.
Just give us more information.
Yes, sir.
Whether we have to have a special meeting or if we can wait till next month, meeting, whatever.
Not a problem.
Be glad to do whatever we can do then.
I'll make sure that Mr. Falk has more information than what I've been able to provide thus far. As he said a while ago, I've literally got boxes of stuff from since that thing started, so I just need to dig a little more. But, gentlemen, thank you again for your attention tonight.
Next on the agenda, Mike Lakefield, discuss hospital.
No, my foot almost went to sleep. Sit back. You need to go pass out.
Okay, sure.
Is there anything enough? I'll pass them out. Everybody got?
Mr. Chairman and other members of the commission, council over there, Ms. Powell and Gary. I want to say good evening to you. And my name is Mike Layfield, and I'm the CEO of Jeff Davis Hospital. Been on board for about a year. And I represent the board of Jeff Davis Hospital tonight and bring the message to you. In your packet that I've handed out, I do not expect you to read the packet tonight. Some of this information has been given to you. I just want to give you an overview of what's in there. There's a cover letter in there. There's a copy of the hospital strategic plan for the next couple of years. There's a list of our capital equipment needs through the year 2017, totaling $2.5 million. And there's a letter to some of our representatives, Lucas and England, who are over the Rural Hospital Stabilization Act. And that's why I've written a letter a couple of times trying to get a little help for our hospital and help us out with some assistance from our county next door. We also will be talking with Tommy Williams and Jimmy Pruitt about some of the issues here at our hospital. And I think they can give some help to us. We are a 501c3 hospital authority. We're here to ask for financial support for our hospital in the form of a special sales tax of 1% for hospital operations. So, and that would also include the SPOSH money that we already received, about $240,000 a year. So I'm here to ask for financial support for our hospital in the form of sales tax or any other way that you might know of. This should produce about $100,000 a month for our hospital. I submit that we are a relevant and very important business to our community. Not only do we provide important health care services, improving lives, improving health care, and saving lives, but we're also an economic engine to our community. And I think you would probably attest to that, since he's the one that looks into that. We provide over 900 admissions a year at our hospital. You may not know that. We have over 14,000 outpatient visits and procedures we do, and 8,000 ER visits. Our mission is to improve the health of our community and save lives. If you just want to get to the bottom line. We provide very high quality services. We don't boast it a lot, but the government measures us by something they call CORE measures, which is clinical outcomes, and HCAHPS, which is customer service. And consistently, we receive high scores, highest in the nation, in many of the instances, not in all, but in many. We have a 50-year-old building, but in that building, we've been able to provide some excellent equipment here today. We just put in the 64-slice CT scanner. We had a 32, so we upgraded. It provides higher quality. It's a low-dose scanner for radiation. Just put in a new piece of ultrasound equipment. Just put in a new electronic health record system. So we've been buying equipment as we can. We have very low debt at our hospital. Healthcare reform has made major changes to our hospital and caused me and all the other hospital administrators in this state great concern. You've heard about Obamacare, the Affordable Care Act, I think. And what the government's focusing on doing is cutting costs of the Medicare system, cutting costs out of hospitals for what they pay to hospitals and doctors, and lots of others, home health agencies and people like that. If you look at the debates as to what's going on with health care reform, the Republicans and Democrats have been debating and cut out who's got the best looking hair and who's got the prettiest face. They've been talking about what they're after is one thing when they talk about it, and that is the entitlement cuts. And entitlement takes up some 80% of the health care of the budget of the United States. Social Security, Medicare, defense. So where are they going to go cut? They've got to cut Medicare, so they're going to be cutting us more. And my point is, our hospital and others in the state will need some financial assistance. Our hospital, Jeff Davis Hospital, is financially fragile. Has been for, as I look back the last 10 years, we have made a profit in some years, but in most years, we've been losing about $1 million to $1.5 million a year. We would like to change that around, and we're making some plans to do that. But we can't continue doing that, so like most hospitals that are successful in this state of Georgia, they receive some support in the form of millage or tax support from their county. In the handout, I gave you a list of 8 hospitals that receive tax support in our area around the state of Georgia: Elbert, Evans, Candler, Morgan, Putnam, Arlington, Effingham, Liberty. They all get tax support, and they do well in most cases, not in all cases. If you get money from the county and you squander it, you may not do well. But they get anywhere from $250,000 a year in tax support to $3.5 million in tax support from the counties. So I'm not asking for something that others don't receive. So, just to talk a little bit about more of the changes going on today right now about our industry. We get paid from Medicare, Medicaid, and then we get paid from commercial insurance companies. Commercial insurance companies come every year and probably ask if any of you are businessmen out there, did you rate, or tell you that your premiums are going up. They also come to us and say that we're going to pay you less than we paid you last year for the same services. And how can, and we take it. How do they do that? Because they have such a large volume out there, we can't turn them down. So, we get paid, for the most part, 45 cents on the dollar. Healthcare costs look high to you, but when we charge you $1, we typically get reimbursed 45 cents. So that's where healthcare comes from. Medicare funding, you heard about sequestration going on about 2 years ago, we shut the government down. During that time, they came in and cut us 2% out of what Medicare pays us, and they get ready to do it again. 2 new programs are coming, Medicare's come out with, they're cutting us on readmissions to our hospital. When we admit a patient, we're going to discharge you at some point in time. If we readmit you within 30 days, we're going to get a penalty. And then if there's an acquired infection, which I think is a good thing, in our hospital, an acquired infection while in it, they're going to penalize us. I'm happy to say our infection rate is lowest in the nation. Our governor also decided no Medicaid expansion. That's where more people who live below the poverty level could have health insurance. But our governor decided not to do that. At our hospital, you may not know this, but we have a high incident charity care rate. We, at our hospital, we give out, or we provide over $5 million in charity care. It's a little under $5 million, but I'll round it off and say $5 million in this going on. We provide that every year, so if it's right around $4.5 million that we provide in charity care, that means we've got to make $4.5 million before we make our first dollar to buy equipment and pay salaries. And that's going up, and that's why I say, this year we're probably going to push over $5 million in charity care. A lot of this comes to the emergency room or just providing care to patients. The new model in healthcare is decreasing inpatients and growing outpatient volumes. And we want to focus more on helping our community with diabetes issues, with obesity and things of that nature. I don't quite have enough money to do that right now. Our industry is rapidly changing, so we're going to have an innovative new mindset, and I want to go over some of the things we're doing to offset other things that the Obama administration is doing to be innovative. Under the Affordable Care Act, the Obama administration just came out with 10,000 new codes for us to code by. We had 6,000 codes. Whenever we provide a service to do an X-ray of your leg, your hip, your foot, whatever it might be, we have to code it. They just gave us 10,000 more codes, about 16,000 codes we'll be using at our hospital. Some hospitals have 30,000 codes. It's very confusing. It started October 1, and we're behind on payments right now from the government because they're sending everything back to us right now. But I ain't going on about that. There are 30 more platforms under the Affordable Care Act for us to pay patients on, 4 more CMOs. All this costs us more work and to hire more people, so it's at a lower cost. Reimbursement when we go. Not here with my hand out, and we're doing nothing about it. What we're doing, just real quick, I'll summarize here and hopefully be out of here in about 5 minutes. We have a lot of things we're doing that we should be doing, and then we have a lot of innovative things going on in the hospital. We've cut costs by $300,000 a year over the past year. We lost about $1.3 million last year, should be about $1 million this year. All of our employees are on a 72-hour work plan. They don't work 80, they work 72. And also overtime has been cut out. And a lot of other things we do to cut costs. But I'm not going to go into that tonight. Implementing a self-funded employee health plan starts January 1. We're going off Blue Cross, we're going to self-fund ourselves. Had we done that last year, we would have saved ourselves $300,000. That's how much Blue Cross kept what we sent to them. So we're estimating we could save $200,000 this coming year. Now, the same plan is being rolled out to business and industry in our community by us as fast as we can if you're self-insuring. And we think we can save you hundreds of thousands of dollars from your health insurance from anybody that's self-insured. In our emergency room, we're trying to do what we can do. If you're not a true emergency when you come in, we're trying to charge you $150 up front. Telemedicine, we think is a way of the future for small communities. We can get a lot of doctors in here, specialists in here, via telemedicine. Just like the screen I'm looking at right here, you can actually see your physician, he can see you. And we have lots of devices, little Dopplers that we can look in your ear, down your throat, your nose, your dermatology, ENT work, even psychiatric care can be done via telemedicine. But we assisted Jeff Davis Schools with a grant to get them under telemedicine, and we're offering this local businesses now. We've added a psychiatric group therapy program. This is for people 65 and over. It's called the Harmony Center. We are seeing 10 patients a day there. Now again, our unit just opened up a month and a half ago. Opened up urgent care center, get ready to expand the hours. We've strengthened surgery, added Dr. Butler. We've entered into affiliation agreements to help strengthen ourselves with education, policies and procedures, and equipment and things of that nature by affiliating with Meadows and Vidalia, and just recently Memorial in Savannah. I've mentioned to you that we get high quality scores. Do we get some complaints? Yes, we're not perfect. And I think 97%, 98% of what we're doing out there is wonderful. And to my knowledge, we've not lost a patient because of lack of care in our hospital. But we try to take care of complaints as best we can, and we learn from them. We're implementing the swing bed rehabilitation program. My Joint Commission came in this past week, and we are Joint Commission certified, which is the highest certification you can get in the nation. And as soon as we respond to them, we should get that accreditation. We're looking to put in a rural health, federally qualified rural health clinic. We hope to have that in a year and a half. Adult daycare center. We're adding new clinical partners, opening up a new clinic with Bonnie Pittman here in a few weeks to help ourselves out there. And we're building relationships with Dr. Sidney Wright, Jefferson County Hospital. We're blessed to have 4 young physicians on our staff. And then we are out recruiting physicians right now for those that are cutting back on their practice. Some of our aging physicians have talked about doing that. And just as a side note, when we recruit a doctor in the town, you may not know it, but it costs this hospital from $400,000 to $500,000 to recruit a new doctor in town. They don't just come and single out and start work. And that goes on in all hospitals.
Explain that.
Okay, how that works is two things are happening right now in our industry. Well, we take a family practitioner group of town, they want a guarantee on their income of a salary of around 200,000 plus. You got to guarantee their salary for a couple of years until they get going. Now, if they exceed that salary, within say the 2 years, we might do an income guarantee. Then we stop, paying them. We also hang a hickey on them that if you come here and we provide you with an income guarantee, benefits, office space, and a hiring bonus, we've given some as much as $100,000 in the past to recruit them in here. Then you will promise to stay here with us to the amount of money we gave you, say, for 5 years or 10 years. So that's how you come up with, just easy, if you give a doctor $200,000 income guarantee, the cost of running this practice is going to be around $150,000 to $200,000. You're going to advertise and give them a bonus, so you're pushing $400,000 to $500,000 just to recruit one doctor in town. Now, we get it back, triple and quadruple fold for the services that the doctor provides and to help you run your community. The other side of it is some of them want to be employed, so you get the same money flowing out there, maybe even a little bit more if you employ them. Most new doctors coming out won't be employed. So just running off to conclude my remarks here real quick. I've talked to you about the healthcare reform, the coding issues, Obamacare, 2% cuts, commercial insurance issues, our old plan that we have that costs us money constantly. And by the way, we're not putting any money away for a new hospital. When you're 50 years old, you need to be putting money off into a little account on the side and go. You can't just stay where you are because you begin to develop lots of issues after 50 years. And I've talked to you about the $2.5 million in capital equipment needs we have between now and the end of 2017. I've talked to you about charity care, around $4.5 million, going to $5 million soon. I've talked to you about quality care and some great plans that we have, and I've given you the strategic plan. Didn't go into that in any detail. So I would again just submit that we are very relevant to our community in terms of the quality care we provide, to the economic engine that we are. And the economic engine comes in where we have a salary budget at our hospital of $5 million. And if you take a 2.2 multiplier of that means we're putting back over $10 million back into our community. In a small facility like ours, you use 3, multiplier of 3. And I'm sure Juliet back here would confirm that. So that gets us up to $15 million that we put back into our community every year. So we're doing most all we can. And we come to the county and we ask for support to help us continue doing what we're doing, growing our business operations, and be all that we can be and be all that we aspire to be, or we can stay financially fragile like most other hospitals in the state. And I think this county deserves that. So I thank you for your time, and if, I'm not asking you to take any action tonight. I'm asking you to consider doing this for us. It's very important that we ask this. Love you, and we think we need it. And if you'd like to come back, have me back for maybe a special meeting, because I've worked with other hospitals and done these talks before, and often the county commissioners will call us a special call meeting just to discuss this issue, because we can be in here all night otherwise. So I thank you for your time. Thank you.
How many employees do y'all have?
We have a little over 100 full-time employees and 150 on our payroll.
100 full-time and 100, is that what you said?
Yes, sir.
There's about 50 that's on the payroll.
And how many of them employees live in Dutch County?
I'm not sure of that, but I I would probably say 70% of them do. We got 30% that come from outside the county.
And how many patients do you average per day?
We've been averaging 10, and for the past month and a half, someone just asked me, we've been up at 15 patients a day. Now, we're in season. So in season, as we call it, it goes on for the 6 months, starting October, all the way through March or so. We'll run 15, 20 patients on average a day. In the summertime, if you will, we may drop down to 4 or 5 patients. This past July the 4th, we had 0 patients in the hospital in one day. So we bounce around. But at the end of the day, I'll tell you this, we improve lives, we save lives every day at our hospital. And you can go, you can say, we don't want a hospital, we don't want help, this isn't what we want to do, but got funded. But seconds mean lives. And so you can go north, east, or west of us, I guess, and find a hospital pretty quick, and not good enough. No. If you take too long, you took up all my time. He's my good friend. Yes.
No,
If y'all want him to say something.
There's a lot of added value with, since Mike has been here, we've sat together and come up with some ideas, some pretty outside the box thinking, I believe, to help benefit our industrial community. You've all heard about the telehealth that the school system has been awarded and implemented, which is a wonderful new technology. Mike and I were working individually and realized that we were working towards the same things. So we sat down one day and we decided to put our efforts together. Unfortunately, we haven't been able to reach as many as we would like. I know he's been in the process of moving and everything, and we've been just really out of pocket here lately. But some of the programs that he talked about tonight, I've got to know a lot more about, and Mike is really putting forth every right effort, I can tell you that. Our industrial community, we have reached out to some of them to try and implement this industrial telehealth, and some it has struck their interest. Others aren't quite sure what it is, but we're going to keep working together and get that rolled out. He's really doing everything he can to make sure that this community does become a healthier community. I just want to say that to back him up.
Thank you very much.
Thanks, Mike.
Based on the attendance approved change deadlines on solid waste management and comprehensive planning. We met with these a few months back. Gary can explain a little bit about it.
Yeah, well, we have to do our comprehensive plan next year, and the solid waste was done not at the same time, or it was updated since that plan, and this vote is to put both of them together because it makes sense to do it all at one time.
Our solid waste is coming up due right shortly, but others not, but they want it to combine.
Right, this makes it simpler to work through and do it all at the same time. So it's just to change the dates so that they both agree with each other for the renewal.
Got a motion, need a second? All vote. Next, approved for the regional commission to exist preparations of the county's joint comprehensive plan. Solid waste, this goes along with the other.
Right, this is the actual plan that has to be done.
I'll make a motion to accept.
Need a second? All vote, none opposed. Next, approve, deny, reappoint Keith Carter, Hank Hobbs, Wayne Hall to the WIOA board.
I'll make a motion to approve their.
All vote. To approve or deny the appoint Ryan Harrington to the Board of Tourism to represent the county. I need a motion. All vote. approve or deny roads missing from maintenance schedule.
We're gonna go over them one by one.
No, all I need is a vote to approve the package of the roads that I gave you. These are roads that aren't on our schedule, and we need to have a definitive list, so when we,
Three that you give me,
right,
I'm gonna check them out, each one of them, they need to be continued graded.
okay, well, that's,
The one you give me needs to be continued graded.
okay.
If they've been graded, they probably.
These are kind of, these are pretty much the grandfathered in roads in the county, but we wanted to have a list, because Robert and me don't know what these roads are, so they went through and made a list of every one and provided to me, so what what we want to do is get it approved, so we know that we're supposed to take care of these roads.
But, when you say take care of it, Gary, we're talking about grading.
Grading,
Where
right.
they haven't, we're not talking about putting in pipes, digging
No.
ditches.
No.
Because if we start digging ditches on some of these roads, we're gonna start throwing water somewhere else, on somebody else, and we're gonna have a lot of, trouble because we don't have the right of ways, and we don't have, if a bus goes down it, or ambulance needs to go down, a fire truck or whatever, we need to have it where they can. But, that's after we said that we would take that one going into Lake Alhead, and we graded, then the next day they called me and wanted us to put a pipe in. And I told them we couldn't put a pipe in. And so that's what I just want to make sure, when we say we're going to maintain, and that's going to be grading the road, we're not.
Right, I should have been a little more clear with
But,
that.
and I meant to call you today, but I've been tied up, one at that Lake Alhead, and then they want us to put a pipe in, and so they don't own the road, we don't have the right of way on the road, and then we're gonna throw all the water on Mr. Simon's work.
That ain't
We
gonna work.
can't do
Just make the motion for grading.
it. Okay, that's what I was.
That'll correct that.
I'd like to make a motion that we set the roads that we have here to be graded by the county. And they do it now because I've talked to some of them, not every time they go by, it might be every 2 times, every 3 times as needed. And I think that we need to let the road department, or the roads that we got named here, and just do the grading on it at their, call.
All vote. To approve, deny dirt hauling from Haddonstein Road from Cliff Lewis property. This is dirt that we have already dug and stockpiled. The dirt belongs to the county, and when we start on Haddonstein Road, we're gonna need that dirt.
And that's right there on the
Right
road.
there.
Plus, he's got some more that
Got to be done.
there's got to be done. And, the only thing that I would like to throw in my 2 cents worth is here, that I have seen people that we just dig a hole, I'm talking about 16, 18, 19 foot deep, and we don't need to do that. We need to taper those edges
For safety.
for safety, to where somebody come and fell in, because I mean, they don't fill up with water. And we got some people that has called me before, no, I don't want you getting dirt on my land, y'all left one in a mess. So, Cliff had called me a couple of weeks ago and said that he had some more, and, but he'd like for us, to take and taper it. And I told him that when we made this motion, we put it in the motion, that we wouldn't just dig a pit, a hole, that we would take the excavator, and he said, that's still a good bit of dirt you can get to put it back in.
It should be tapered.
It should be. So that's the way I'd like to put the motion.
I'll second.
All vote. Next, approve or deny reversion to the county travel policy.
A while back, I enforced our policy the way it was, and I got several complaints, and it's somewhat outdated, so I felt like the best solution to that would be revise the actual policy that's in our handbook and give people the option. Some of the county vehicles are old, and some of you mentioned to me that it might be a good idea to allow people to drive their own vehicle instead of forcing them to drive a county vehicle that might not be as safe for some of the ladies as some of the,
Well, they're not as used to it either.
Right. So what this policy is, gives a couple options. You can take a county vehicle, or you may choose to drive your personal vehicle, which you'll be reimbursed for the round trip mileage based on the shortest Google Maps search from Jeff Davis Street here to the destination and back. The mileage reimbursement will be the IRS standard business rate. And only one person per office will be reimbursed with multiple attendees for attending the same meeting. So we just kind of clarified it and detailed it a little bit to make it clear, and I think this will make a lot of the people happier than what they were.
I'll make a motion.
I need a second. Wayne second. All vote.
One other thing here that we need to mention here, like the assessors, the board of assessors, and all that they're not county employees.
This is for county employees.
Okay, that would be for people that work 40 hours a week and work at the courthouse.
Right.
Is that correct?
Right.
Okay. It need to be in there, Ms. Carlin, is for the county employees, and when it works for being a full-time county employee, that they would fall under, but then people.
It should be covered in the personnel policy, the definition of county employee, and it is 40-hour.
40-hour week, benefits to get holidays and things, so
What you
it's one
can
that's
do
not.
is just vote on or approve it based on the days in fact, otherwise they change the county personnel policy. The definition of county employee. But yeah, you can approve it, give days, and then you might want to bring it up the next meeting to check the policy. So you can just change your motion. Vote to approve pending, if that's the definition of county employee. Just says attendees that that's the county employees.
So, people on the board of assessors, we wouldn't even have their license.
Right, they're not insured to drive the county.
Same thing with the board of equalization. So, notice one that would be, and if we would have a copy of their driver's license, that would be a full-time county employee. But I need to read, Mr. Jerry made the motion that we need to call it back and revise it and say that this year is
Got what y'all want to
full-time.
revise?
Yeah.
I'll make a motion to revise for the full-time employees.
So I need a motion. All vote. Next, approve deny term limit policy for local boards.
A while back, we realized that there was a motion made in some previous minutes where the policies, the term limits were set for 2 years. So I went back and reevaluated that, and in discussion, we decided that we would amend that to be 3 years. And I've got the documentation in your folder.
But there's also, Gary, there's also some boards that we can't.
Right, this is just for local boards, it's not for regional boards or boards that are under control of the state. And it's also not to supersede any current bylaws that they may have as well, so.
So their bylaw, I got 2 questions about this when I did it. First of all, if their bylaws supersede the commissioners and you're saying that they have to go by their bylaws?
I'd say we'd have to change their bylaws if that's the case, if we want to change that to 3 years. I just didn't want to override the
And that's what
existing
I'm asking,
bylaws.
is they've got existing bylaws, all of them, that say more than 3 years. You're saying.
We have to vote to change each one.
We like the rec department's 5 years,
Right.
and
Well, I thought it was changed to 2.
Well,
The
that's-
rec
that's-
department does not have any bylaws.
That's the dilemma we've got.
that's the number that we have got, and they don't,
we got.
they don't have any bylaws, when they go by, I've never seen them, I've asked for them twice.
It's not, it's just an advisory board, they don't have bylaws. But my question is, if we do have a legitimate board that does have, you said it's not to supersede existing bylaws, then,
Then we would be changing it.
okay, that was my question, because, also one board, I don't know if y'all thought about this, but I thought, talked about it was the development board, that was statutorily created.
Right, they do have bylaws that we would have to, all three, the city of Denton and Hazlehurst, they would all have to vote to change those. It's my understanding.
But they would have to,
Right.
a joint resolution.
Right,
Just
exactly.
vote all three.
Exactly.
So
That's why I
are you
put this in
saying-
here.
Well, just answer my question, are you saying this affects them or it does not affect them?
It would not affect them.
And any other board that has bylaws, they're in conflict with
Right.
what this board is saying, you say will not be affected.
Right. That's the intention at this point. We have to take that up separately.
Well, if that's the intention, then why do you need to vote on it? I guess is my concern, because you're not doing anything unless,
Well,
what order you want to change, I guess, before, I mean, you get their bylaws and see, because otherwise.
Well, the purpose of this, or at least the focus of this reasoning was the rec department. But the old,
So they got 5 years.
the old minutes were like for all boards, so we needed to kind of try to fix it.
can we notify each one of these and ask them that they have bylaws and to send it in? And you text us and tell us that you've got them and put them in our box and we come back and get them. And, because we had talked that we was going to add a couple of people on the rec board.
Right.
No, we voted on that.
Yeah,
Yeah,
actually.
we voted on to do that, but we didn't vote on, we had, we voted on the, yeah, and, so that's what I'm saying, so, but, and then they don't, we've been said that they don't have any bylaws, so we can change theirs to a 3-year term.
Right.
Okay. And then what we need to do, there's 1, 2, 3, 4, 5 on there now, so we're gonna make it 7. And we need to alter that thing to where there's like 2 or 3 coming off, but not, 5 in 1 year or something, but,
You
I
know
would,
how if they start running, there won't be 5, there won't be.
We'll have to look at the ones that are on there now and see
Yeah.
when they're, I don't have that in front of me.
I have right here.
for one Coleman is, turning in 17, he's raised in 20. Johnny Bohan in 20, but that's the 2 that we just appointed.
That's a question I got if I can speak.
Yeah.
Can I?
Yeah.
Y'all voted them in June. And somebody somewhere says there's a 5-year board term for the rec department. I've never heard of it. I've been on that board. There's no bylaws. Now, y'all appointed them in June. Are y'all gonna go by the November the 11th, 2000, or November the 30th, 2011 policy and give them a 2-year term? Or y'all gonna give them a 5-year term? Or are y'all gonna put them up under this new policy?
3 years.
For 3 years.
I mean, y'all voted them in June. Which policy are y'all gonna follow?
When we changed this thing, we asked everybody for their bylaws and see what their bylaws said. If their bylaws doesn't go
The
with
rec
the.
department does not have any bylaws.
But that's what I said, if we're gonna ask them,
3.
then we're gonna change it to 3.
The rec department's not having bylaws if it's Hazelhurst GFA.
I understand you saying that, but we're gonna ask them, we're gonna ask everybody.
Jerry Wooten and I worked on that when he was on the board before.
But we're gonna ask the Board of Education, the Board of Tax Assessors, the library, everybody that we got, and let them, give them a week to turn their bylaws in. And then Mr. Gary's gonna text us and tell us what's in the box. We come by, get it, we read it, and then we go in to change it. If there's no bylaws on there, and put everybody that we can on a 3-year term, unless they got something to say we can't.
We can't.
That's my opinion. I don't know what the rest of them.
That's what our goal was.
Now, can we go back to them applications we already had and point the 2 next time, in December?
Well, I think,
Yeah.
let's,
Yeah.
let's, that's me. I think that we need to get these things, read them, see how many we're going to change, advertise every one of them. To, if somebody wants to be on the board, I think the one's supposed to be, not board of assessor, anybody wants to be on it. I looked through this, and I had to note this ain't gonna add, but, a couple more we're gonna add to the rec department. There's something to be changed on a lot of boards, and we look and see once we change it, and everybody the 3 that we can. And then turn around and see who's coming off and what, and run it in the paper for 2 weeks. get the application in and then vote them in. You don't agree with that?
Okay, so you need a motion to table this one.
I make a motion that we table this tonight till we take and find out and get the bylaws brought in to see what their bylaws is, to say that they're supposed to have, and if not, then it comes back, and then we can change it to what we need.
All vote. Next, hear from Ms. Carla on the update on the county property. Joe Toller,
Joe Toller, I had checked Joe Toller's here.
no, he's not here.
I had checked his title, I have not had a chance to speak about it with him. In his title, I did not find anything where, there was any kind of easement to the county. If you look on his plat, which is kind of old, he doesn't have a new plat, it was 1973 or 75, I can't even read it. There is on one portion of his property where it's showing a 30-foot access road. So I don't know if that's what he was maybe thinking when he said on his plat it was an easement or not. And what I would like to do though is check Ms. Brenda Rowell's property. She was the other lady that was here at last night's meeting who stated that she had the 30-foot too. Because I want to check more than one just to make sure, because if it was running through one, even though one had one didn't, you can't just maintain part of it, y'all have maintained it, or not, while the county would have maintained it.
That's why I thought we were gonna do it, I thought we were gonna take that whole deal. That was the last meeting.
Is this 30-foot access road anywhere near that low place where he's talking
That's
about
where he's
digging?
That's his driveway, yeah.
And I'm gonna tell y'all, but one of them lives on one side of the Douglas Highway and the other on the other. And we ain't got right to get on that state highway. And,
The state's done their part,
They've done that,
that is, okay.
they don't want to tell them.
So what I'm saying, I thought that last month meeting, we was gonna have all that through there, that everybody's property, so we would know now.
See if we got the 30-foot.
Yeah, if we do or we don't, doesn't count.
You'll know.
But that don't say.
I had just checked out Joe's, and I had his name written down to check his title, because I thought that that's what, and voted on, that's what I had in my notes. And then I was just gonna check Brenda's, because she was here, and she was concerned also, and I know they want to sign it.
No.
So that's what I wanted to check, both sides. so to
Well,
speak.
But according to them, there's a ditch or a right of way that
The county's supposed to maintain.
runs from
From
wherever, I don't know.
I don't know.
Being it's in your area, I'm not throwing no dart at you, but can you, we know this one is on the other side of the road. And we know Joe's the first person on the, coming in town on the right-hand side of the road. And then can you live there and know the neighbors and where the ditch kind of went? Can you get those names who owns that property? And then Ms. Carla can look the map part.
I imagine it's that list.
He
Well, he has that petition, yeah, he has that petition out
He
there.
brought this thing, I'm talking about it goes way back behind Brenda's. I mean, there's people way back, supposedly where this ditch goes, all the way to the Doug's Highway. And then back through to the,
It's not good.
no, to the old Douglas Road, dirt road. That's what they talking about.
And
Give me that.
from what
Share a
the
copy of it.
doctor's problem is they've been ponds put in there that is blocked that. All I know is a wet hole.
But there is no, to answer your question, Wayne, I visually can't see no ditch.
Well, he started talking about those trees up big around it.
They
So
are.
if they trees that big around it, and that grow, they don't grow in 30 years, hardwood.
I don't think it's been done since he bought that property. She
But
said
one
back
time,
in
there was like a canal through there, because I walked in it when I was in
He
80
bought it
years.
after 87. I didn't bring this to you, I just bring some notes. So, yeah, but when you bought it according to the plat, it was 75 or 70.
Me and Isaac.
Would there be anything anywhere, Carl, that would show that ditch going through all them properties that it belongs to the county?
There could be, if you check all those titles and it goes back far enough, it may just be in one. See, I went back 50 years, but it might have been on his track, but it might have been 60 years, and I just don't know.
I can't believe that if it is a
They
ditch,
don't
it does
have
put a
to.
canal. Yeah, but if it's a ditch access.
And that's what I'm.
It don't say ditch.
It ain't a canal, it's just a ditch,
It was like a canal line through there. Isaac Boogie was there when he first started, and he said, what I told me when we looked at it.
All the way through, so where's?
I don't know how far they dug it through.
Behind
We didn't.
I don't believe you'll go past that first road, so that ain't nothing but swamp.
Yeah.
Yeah, but first of all, we can't just go in there and dig a ditch and let that water.
Part of the problem is, when you look at the elevation maps, it's flat in there.
It's flat.
There's nowhere really to, no matter what.
That's the
ditch you
problem,
dig.
there's nowhere to.
That's why it's the way it is, yeah.
Here's the thing, we got to see,
If
and
it's
I
all.
thought that's what we're doing, but we
That
need,
is what we're doing.
well, just on one person's property, we need to know that, where's it at? What's the county on?
Now, from Douglas Road to the Bell Road, we keep up with him. But from Douglas Road back to that Polk Road, that ain't nothing but swamp. But if the ditch was put there, that would help take care of the water problem.
I don't think you put these in there.
You ain't gonna put one from into your street, you bury everything you got.
Well, they know what, that's higher than what you talking about.
Is it? I don't know.
Yeah,
All I
like
know
where my
is
house
we-
is about the highest place in the whole neighborhood. And when you dig this ditch, all it's gonna do is make pond, it ain't going that way.
Well, that's
Unless
where
you
the
go all the way
water
through
runs.
that property with a ditch.
When it's wet, the water runs through that place.
When it's high.
Yeah.
But again, it goes back to if it's county property. If it's county property, and it's up to us to call the Army Corps of Engineers to get permission, and that's really where the rub is. So
Yeah, it is.
if it's his property and he wants it dug, then he has to call. That was the problem we had before, is he called and told him, he was calling for county property, I imagine, is why they didn't take him
Look,
seriously.
Walmart didn't build them ponds out there and put them vents around it because they want them ducks. So they built them there because that they have so much asphalt in the land mess with, and they told them, you're gonna have a retention pond. And we fixing to get into that, and the county don't want to get into that for co-engineer or either, soil and water, that, because somewhere it's gonna stop. You gotta stop digging.
Right.
When you stop digging, then it's gonna flood what's beyond it. And so, I mean, we need to find, I mean, the other one, the one that goes and crosses at Hayhurstfield, goes all the way to Lake Mayor. And then it crosses the backs of the highway, out there behind running them place, it comes across the road there into Beasley, the other side of Beasley, down over the whoops, and right on in. And.
Well, this is the reason I took all these precautions, to make sure before we just went out there and
We
started.
could, thank you for doing it, because, I mean, we can't. But, that one there is listed over there in Genesis' office, and they deeds up there in Byron's office, and I got them at home. Until that we supposed to keep it, it was turned over to the county once it was dug by the Corps of Engineers, and then we supposed to keep it up. And it's been, what, 4 years ago, we went down through there and dug it out all the way. But that's not what we're gonna do like that.
It don't look like it to me, but I mean, you know,
We
we got to be able to tell this guy that that's not ours, or
You gotta tell him something.
Yes.
So anyway, I'll continue on those if you do.
so on Joe's, you're saying that,
I'm not Joe's, what I'm saying on Joe's is that according to the title that I checked, there was no deed in any of the back, I mean, there was no deed to the county or easement to the county for any kind of ditch
Adjoining his
in or
property.
around Joe's property.
okay, that's what
There's 911 bill, I didn't know till I got my packet that this was going to be on there, I'd rather discuss that in executive session. That's what that was the appropriate form, it's not on here, so if you want to go in executive session next week, or I mean next month, or if y'all have a meeting before then, we can certainly discuss that then. Hotel motel tax, I talked with the attorney for Nunwick. Was it last week, Susan? Did I call you? He apparently finally got served the letter that I mailed in August. He got served about 2 weeks ago. By Fulton County, apparently that's not on there, or behind him serving documents from the sheriff's office, which I can imagine since the county's so large. But at any rate, he said that what they had been doing, and that he had all this documentation to show me, when they had been paying hotel motel tax to the state along with the state tax that they have, sales tax, which is what I think Susie and I had talked about, trying to contact somebody and knew that we could contact them out of state. So he said that they're willing to pay what they owe, if I will give them a figure. Well, I said, I'm not gonna give you a figure until you give me proof that this hotel motel tax was paid into the state like you said that you have. I said, because my board of commissioners will want that. So on Friday, he emailed me a 69 pages of the tax returns that he had sent into the state showing the amount. So this, of course, today, Monday, I have not had a chance to get with Ms. Tax Commissioner and go over those 69 documents with her. So that's where we are. Once I do, and she and I agree or disagree that that's what the case was, then I'll present him with the figure that he knows. And he said he could get the check within a week.
My question, how long is he gonna try it down?
Because well, they said he wanted to pay it by the end of last week, and I said, no, because I'm not throwing out a figure until I see the documentation. Just to cover us in case it comes back that, they have or they haven't, but at any rate, that's where we're on that. And I did email him back, just per our conversation, just wanted to email me blah, 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 so then he did respond, say, yes, I will get it to you within a week of the final figure. So, hopefully if I can get with Ms. Tax Commissioner during the week, we should have the check within a week.
Can I ask a question?
Sure.
If you looked at it any, could you tell me what, you hadn't looked at it at all?
No,
I'm just curious as
but I
to,
saw 69 pages.
Well,
I did look at the first one.
Well,
And
well,
what
I was-
it is, I'm sorry.
I'm curious as to what form and how he was filing that with the state. I mean,
Well, it was, I looked at it,
right, I don't know of a form that you filed with tax with the state, so, obviously, I'm glad he's
He was
willing to
telling
pay.
me what he was sending in was the total amount of what I was selling.
Total amount of,
Hotel motel and what was over.
Sales tax?
Yes.
so he's reported on the sales tax.
That's what I was told. Now, I had to read the documentation.
Well, I understand that.
That's why I want to get the tax commissioner to see if she recognizes the document, because she's going to know more about that than I do, because they don't deal with that.
Right, and I'm just curious, and if I don't mind coming and looking at those with you too, I don't, but it's just curious to me as to when I heard and I was talking to Susie's office on another matter, and they relayed to me that they had called and that said that it had been sent to the state as they had been claiming they had. But still, Susie told them several months ago that money didn't go to the state.
Well, no, I think what Susie said is that there was no way of us knowing that if it went to the state or not.
But I thought you told them that money wasn't supposed to go to the state, it's supposed to come to us.
Supposed to, yes.
Yeah.
But I'm talking about that's not what he said.
But so there's been several months